Hey everyone, my name is Hannah Robbins, and in this video I'm going to be discussing with you all and demonstrating for you a grounding exercise known as alternate nostril breathing. So the main purpose of alternate nostril breathing is to relieve symptoms of anxiety or stress by allowing a person to focus on their breathing rather than their symptoms. Outside of this main function, alternate nostril breathing is useful for reducing heart rate, reducing blood pressure, and improving overall lung function. There's actually evidence to suggest that by practicing alternate nostril breathing for 30 minutes a day, a person may be able to decrease their overall stress levels. So to explain this technique to you all before I demonstrate it for you without using words, I'm going to take my right hand and start by placing it on my right nostril, inhaling through my left. I'll hold the breath for as long as is comfortable and then close the left and exhaling through the right. I'll inhale once again through the right, close the right, and exhale through the left. So inhale, hold, close, exhale. Just alternating between breaths. So without further ado, I'll now demonstrate this technique for you all without using words, starting by taking my right hand and placing it on my right nostril to close it. One more time. And that's all there is to it. So in reality, if I were experiencing symptoms of panic, anxiety, or stress, I would repeat these steps until I could physically feel my symptoms abating, or otherwise until I would feel comfortable stopping. This exercise best serves anyone who experiences symptoms of anxiety, panic, or stress, so all of us at times, and it can be utilized anywhere at any time. I would like to add a little disclaimer that this technique would most likely not be helpful for someone who is unable to perform the motion of placing their hand to their nostril, or anyone who otherwise has a stuffy nose. This technique could particularly be useful for trauma survivors who require assistance in regulating their breathing or heart rate during a moment of crisis, as it has been shown to decrease symptoms of panic and overall heart stress. This technique may also improve the safety of trauma survivors during moments of crisis or panic, as it aids in the body's activation of the parasympathetic system, which is responsible for the body's deactivation of the fight or flight response. So to put that in a less wordy way, by practicing this technique, a trauma survivor may be able to calm their mind for a moment in order that they might assess their surroundings or their situation during a moment of panic or chaos and get the help that they need if they need it and if they choose to get it. Long term, this exercise is helpful for improving overall lung function and heart health, which is imperative for trauma survivors, as we all know that trauma has the potential to affect the body long after it has been experienced in more ways than one. So I hope that everyone found this video helpful and informative, and thank you for listening. Bye-bye.